Welcome, Dr. Farokh Master at HPT Hot Seat. We are very pleased to have you with us again after 2012, and it's a beautiful place to interview here at Pachkani. Uh, since you are associated with academics since long, you are one of the foremost teachers of this generation of homeopaths. My questions today would relate to more regarding the status of homeopathy education and homeopathy in general globally, but especially in India. So the first question that I would like to ask you is that recently homeopathy has been in the news for all the wrong reasons here in India. We have seen that one of our key members of Central Council of Homeopathy has been arrested on corruption charges. What do you have to say about the status of homeopathic regulation in India? You have been a member of CCH yourself for 10 years. Why do you see that corruption has seeped into this body, and what we can do to change the situation?
Well, it's a very difficult question to answer. Since I was in Central Council of Homeopathy for 10 years, and we were 50 odd members, the biggest problem is selection of the member through election. I think so. The members should be more nominated than elected, because election always invites politics. Again, in nomination also, sometimes many people are elected through their connections in the political circle, so that should be very strictly prevented, and nomination should be done only on experience, qualification and the merits of an individual candidate. And we don't need 50 people to run the homeopathic system of medicine in India. We just need 10 people. So instead of 50, we should bring down to 10 people. People who have really practiced and taught homeopathy for more than 30 years should be inducted inside the council. And these people should be totally neutral from owning any institution of homeopathy anywhere in India, so that they are quite neutral in that aspect. They should have at least authored some book, presented some international research papers as a criteria to get nominated. Then I feel that the council will be extremely healthy, educated, and then they can take a right decision, and then there will be very little scope for corruption.
But so there's a lot of administrative work also which is related to the council, like inspecting new colleges, annual inspection of colleges, approval of syllabus. How do you foresee that a small group of homeopaths who are themselves busy practitioners or educationers, how are they going to cope up with those challenges?
Yes, that is also very, very important. For that, what I personally feel is that inspection should only be done once a year and not many inspections. Or certain colleges which has already fulfilled a very good criteria should be only be inspected once in 2 years or 3 years. The focus should be more on those colleges only which are far below standard, and for them every 6 monthly inspection should be done. That's number one. And then let those 10 people or 20 people which are nominated elect another 2 to 3, 4 inspectors, and they should inspect the colleges and not the members who are nominated. And in that way we can reduce loss of that administrative work that is being done in Central Council of Homeopathy.
Okay, that's a very good suggestion.
Yeah.
So homeopathy has been regulated in India since last 50 years, and since 1973 we have our own Central Council Act. It has been more than 40 years now. Where do you see homeopathy stand today in India regarding the quality of education that is being offered?
See, that is the very big thing which I would like to talk about. Unfortunately, India has got quantity but no quality of homeopathy. The skill of homeopathic physician is not proportional to the experience of years for which he has been practicing homeopathy. So a 25 years old practitioner in India may not have a skill of even 3 years practicing homeopath. Teachers themselves are very poorly educated. Principals are very poorly educated. Many central council members are very poorly educated in their skill. And as a result, what happens over here is that the whole focus lies on how many students. In fact, the focus should shift to what kind of students we are generating. Today, the homeopathic doctors that we generate in India, whether undergraduate or postgraduate, are so poor in their skills that many times they can't even measure a proper blood pressure. When they come to me and when they work in my clinic, I come to know that they don't even know how to measure a blood pressure, which is so fundamental and which is so basic. And who is to be blamed for that? As far as post-graduation goes in India, we are just manufacturing people with MD home. There is nothing like MD home in homeopathy. People just pay very high fees, and everybody who appears for examination, majority of them pass. The theses are not written in a proper way. Theses are not corrected. Theses are sold for a particular sum of 10,000 or 15,000. So what I feel is that right now what we should focus more is on BHMS and totally scrap off all the postgraduate courses in homeopathy, because there are no teachers who are teaching this particular course. 5 students come and meet in an MD class, and then the teacher says, okay, now this student will talk tomorrow, that student will talk tomorrow. There are no patients indoor, there are no patients in the OPD, the indoor is totally empty. What kind of MD are we manufacturing at the end of the day, and then how they are going to manufacture the skill? So this is extremely important that we have to scrape out the postgraduate courses in India until and unless we have skillful teachers who can give a skillful training to the students. That's very, very important. And number 2, we should focus more at the BHMS level and teach them the basic fundamental principle of homeopathy. The most neglected subject today that I find in BHMS level is organon of medicine. That particular subject is extremely weak when a student pass off, because they are not able to interpret organon in their practice. Repertory they know little bit, materia medica they know little bit, but the philosophy part and the organon part is too weak. So something has to be done drastically to improve the skills of homeopathic physician.
And what measures can we take to produce better teachers? Because unless until we get good teachers, we cannot get good students.
So this is another thing that unfortunately the homeopathic institutions are not taking help of senior skillful teachers. Somebody would be very good in organon but he lives in Switzerland. Somebody who is very good in repertory but he lives in America. Somebody who is very good in materia medica but he lives in Kerala. Now the college is in Bombay. How can we tap their influences? Number 1, by webinar, by inviting those peoples, and these peoples will be too happy to come and teach. So there should be a total good network of selecting the world's best teacher, and only they should be permitted to either come personally. If they cannot come personally, organize their seminars, webinars, invite them regularly in congresses. This is extremely important. That kind of education is not given. In fact, what education is given is somebody with a very poor skill passes BHMS and in 6 months takes up a job as a teacher in the college, which is extremely dangerous. And then that teacher trains the students. That teacher herself, she doesn't know much about homeopathy at all. And this is extremely damaging. The rule should be minimum 10 years of teaching experience to join a college.
Clinical experience.
Clinically. That's very, very important. And the proficiency of the teacher should be judged repeatedly, and if the proficiency falls down, the teacher should be immediately removed from the institution. Strict laws should be enforced regarding appointment of the teachers. This is extremely important. And invite practitioners also in a local area. Like see if the college is in Jaipur, invite the best of the practitioner on honorary basis. Don't bring a law that they should be full timers or they should be part timers or this. Appoint some professor emeritus. We have got some good teachers in India. It's not that India lacks good teachers. India is full with extremely knowledgeable teachers. Unfortunately, their potential is never tapped.
That's true, sir, because we do see that India has produced some of the finest homeopaths of this generation, of the previous generation. We still have the most popular speakers around the world who come from India, and still we lag in providing the same kind of quality infrastructure to our young students. I hear, because a lot of time I hear even my students, they don't even know the names of some of the bigger, better homeopaths. They are not even exposed to those. So that is indeed a sorry state, and I'm happy that you share your valuable ideas regarding this. How does the state of homeopathic education compare with that in the Western world? Because of late I've been hearing that whether it's in Europe or in US, homeopathy has gone down substantially. The number of students who are attending their schools and colleges, they have reduced drastically, and several schools have actually closed.
Okay, so let me tell you one thing. First of all, whatever India may be today in education, I would still say that India is the best in the world. That's a real correct statement. As compared to Western world, where education is yet not properly established in a structural form. Every country has a different laws for homeopathy. In Europe, every state of homeopathy in United States of America has a different law. And as a result, there is an extremely big chaos in different parts of the world. Some countries accept homeopathy partially, some countries accept homeopathy not at all, in the way that you have to take a permission of a MD doctor to consult a homeopathic physician, which seems quite ridiculous to me. Some countries requires only 300 hours of education to become a homeopathic doctor. Some country requires 600 hours of education to become a homeopathic doctor. Even though we have got ECH and ECCH as an organization which governs homeopathy in the Europe, yet lot has to be done in regularizing homeopathic physician in Europe. As a result, we are only manufacturing homeopaths with very little skills in Europe. This is the main reason why homeopathy is going down in Western country. Number two, there are very few MD doctors who practice homeopathy. I think so homeopaths don't have much knowledge about anatomy, physiology, pathology, surgery, gynecology. And in Western countries, this diagnosis and prognosis is a very important factor when you treat any patients. And since these homeopaths have got very little training in anatomy, physiology, they become an extremely poor doctor when they become a homeopathic physician, because then they start accepting cases like cancer of the breast and cancer of the pancreas, and they make a mess out of the whole case. The patient dies, blame comes to homeopathy. In the newspaper you see with a big heading, homeopathic doctor kills a person. This brings an extremely bad reputation to homeopathy, and this I have seen not only in Europe but also in United States of America, in Australia, everywhere I have seen this. So what I feel is that after passing homeopathy, every homeopath should be given 6 months of anatomy, 6 months of physiology, 6 months of pathology, all those, and only when they finish all these courses, they should be given a license or a certificate that now they can practice homeopathy.
But that is regarding the status of homeopathy. Why are we seeing a decline in the number of schools and students?
This is basically, now I will tell you one more thing also, that I have been teaching abroad for last more than 25 years, and what I have seen is that people have deviated a lot from proper classical training. Now this is also happening in India in a very big way, let me tell you, but even in Europe and America, people have not put their feet very firmly in the roots of classical homeopathy, and on the pretext of easy homeopathy, on the pretext of finding quick results, in the pretext of finding a simplicity in homeopathy. Many neo-gurus have taken birth in the field of homeopathy and projected their own system of homeopathy, publicly announcing that my system is the best and my system works and my system brings 100% results. On YouTube you will see multiple such videos, multiple books are available, multiple webinars are conducted, and so the deviation goes over there where these methods were not totally Hahnemannian, where these methods were not researched enough, and as a result when student takes such methods and learns such methods, the results don't come at the end of the day, and if at all the result comes, they are not able to repeat their results regularly, and so frustration sets in and they stop homeopathy, and then once they stop practicing homeopathy, the other generations around them will not take admission into the homeopathic college, and that's how the population declines.
So, what is the way out? I mean, we don't have any international framework or regulation to actually weed out from what is right homeopathy or what is bad homeopathy.
We do have a framework where only classical homeopathy is projected. In fact, in Liga, which is the supreme authority of organization in Switzerland which controls and which regulates the rules and regulations about homeopathy, has framed certain criteria: who can be a teacher, who can teach homeopathy. All those things are there already, but the implementation is not yet in its full swing. If you really want all these neo-gurus, to change and come back to classical homeopathy, we as a teacher should prevent our students to attending such seminars, such webinars, and to ask the respective colleges not to invite those teachers who teach what is known as un-Hahnemannian or non-Hahnemannian or neo-homeopathy to their students. There should be at least some efforts by we as a teachers or we as a senior practitioners to shun such methods, because that is the root cause of infection. It's an epidemic and it's destroying homeopathy every single day.
But so these people who have come up with new school of thoughts or new methods of prescribing, they say that our approach is not un-Hahnemannian, because even Hahnemann experimented and grew with time. So we are also doing the same thing.
So what is happening is that for the sake of conveniently they take 2-3 aphorisms from the organon and put it into their theory and say, look, we are Hahnemannian. Now what happens is that organon does not have one aphorism. Organon has got more than 240 aphorisms. So it's very easy that somewhere their theory coincides with 1 or 2 or 3 aphorisms of organon, and they will definitely correlate this and say, oh, but we are Hahnemannian. That is not Hahnemannian at all. What is most important is to make a system Hahnemannian, first you should use reliable materia medica. Reliable materia medica means that materia medica where the remedy has been proved on healthy human beings in a Hahnemannian way. You note down the symptoms and those symptoms are recorded. That becomes here what happens, people are giving medicines like helicopter, people are giving medicines like turtle, like crocodile, without proving this medicine in a proper way. They start using what is known as black hole or the planet Saturn and the planet Jupiter, and they have started using mobile phone as a remedy. Can you imagine? And all this is very, very bad. So first, reliable materia medica. Second most important thing is not to make theories from the case taking. Case taking procedure should be as simple as possible. Look at the case taking procedures of Hahnemann. Look at the case taking procedures of Herring, Boning-Ushin, Kent, Lippi, Dunham, Clark. Extremely simple way, the most simplest way. And here the student is totally confused. Look for the kingdom, look for the vegetable kingdom, mineral kingdom, animal kingdom, and even those kingdoms have got so many vague rules that you start confusing whether stramonium, which has got so many animal quality symptoms, is still called as a botanical kingdom and not in the animal kingdom. So all these rules which these neo-gurus have made between kingdom is totally confusing. These neo-gurus have added multiple miasms into homeopathy. I don't know why, there was no reason to do that. They really don't know the meaning between a miasm and the disease, and they are putting typhoid miasm, malarial miasm and different kinds of miasm without even understanding the basic theory of miasm as propounded by Samuel Hahnemann. These neo-gurus are only born because they have really never studied Hahnemann. Had they studied Hahnemann, all these things was really never needed. This is my personal opinion and may not be the opinion of the whole homeopathic community, but I feel that I have validated this repeatedly and I have seen it, and that's the main reason why today's students are confused. These neo-gurus, they keep on changing every 3 months. The beginning they started that delusion is a disease and awareness of the delusion is a cure. And for many years, these neo-gurus propounded the theory of delusion. When that did not work, they went to the miasm. From miasm, they go to a new method of sensation. At 7 levels, you see the patient, you examine the patient at 7 level. When that doesn't work, and you say, okay, now we go in a synergetical form and now we try to go back to classical. This is too confusing for a new student because he doesn't know whether delusional theory is correct, whether miasmatic theory is correct, whether sensational theory is correct, or I have to go back to Hahnemann. And if I have to go back to Hahnemann, why I should go around in a circle? So these things needs to be changed drastically. Students need to be warned about all these things, and students should be instructed to study Pura, chronic disease, organon repeatedly from a very senior most teacher who has really understood those books.
So, one of the problems that I see as a teacher today is that our curriculum does not even introduce the works of people like Lippy, Wells, Clark, Dunham. They are not even part of the syllabus. Even Hahnemann's works are given as reference books, not as textbooks. So nobody reads chronic diseases. So how do we introduce our young students to the works of these masters whom we can follow?
This is the big mistake of Central Council of Homeopathy, unfortunately. The education committee should first of all contain members who are really scholars and who are really academic oriented. They have themselves are not very highly educated. And as a result, what happens is that they, with their political connections or friendship or all those things, only recommend those books of those authors for the syllabus for the students to study. That's a very unfortunate part. I totally agree with you that Hahnemann is in the reference book. When I was in CCH, I was not given any important post in any educational committee or any main committee. The only reason was that I was non-political and I had never had any political connection in Central Council of Homeopathy. But repeatedly, on a friendly basis, I have said that make this as a fundamental work, otherwise homeopathy will suffer. But it went to the deaf ears and nothing happened.
Yes, it is indeed a sorry state that BHMS students after 6 years of education does not read even a single proving. It's not even in the course. They don't even know how a proving looks like. I feel that it should be made mandatory that every student should be part of at least one proving.
This is also another thing that I see, that when they do internship in Bombay at least, where students do proving, most of the students don't even take the drug and they just write whatever symptom that comes in their minds and give it. There is no editing of the proving, there is no seriousness. Mostly it's totally a false information which is given by the students. Students are not monitored regularly. It's a big joke. Let me tell you, it's a big joke.
So you yourself have approved around 10 drugs, and yesterday we were having a small discussion where you said that it's very difficult to filter the noise from the real proving data. After such a long experience, how do you feel that a proving should be done, and how are we supposed to edit the proving after it is done?
Yeah. So the most important criteria to prove a remedy is that the proving master should be having lot of time. Today I gave up proving only because one proving takes 2 years from my life, and it takes hundreds of hours from your private practice. Proving is like a prayer. Proving is like an aradhana, like a worship. It should be done extremely carefully. So I started selecting only homeopathic physicians in the prover list. Secondly, I started giving them salary for proving, because I feel if I pay them money, I can hold them morally responsible. And then we used to have every 15 days a meeting in which we videoed every prover. We also wrote down what every prover said to us, and then we compared his video with what he said, looking at his own expression, how genuinely he is trying to express his feelings. This whole procedure takes about 9.5 months of recording regularly. Once we record all those symptoms, we try to find out all this symptom does give any meaning, does give any theme, does give any understanding. And then 6 months we spend trying to compare what the prover gave and what is the personal history. In the beginning we were not very expert, let me tell you honestly. We also made some flaws. But in the second and the third proving we were extremely careful that where does this doctor come from, what is he doing, why is he thinking in that particular way, why these fears are there as a part of his proving, and why these fears are there as a part of his case taking. That takes about 5-6 months where I interview the prover even after the proving is over, because now I am in the editing stage, and I ask them that something related to proving this dream has come up, what do you have to now say now that you are not taking the drug. And so with this interaction I remove many symptoms which has cropped up into the proving, and then finally what filter remains, that I try to publish and give it to the profession. And I purposely selected only snake kingdom in my proving because I wanted to see that if I do 8-9 snakes in homeopathy with the same provers were not very different, hardly we change about 4-5 provers here and there. I wanted to see how 9 different poison has got different effects on the same prover. So this was my criteria, and I did this kind of contribution, but now I don't think that I have that kind of energy to do a major proving. I can supervise a proving, but I cannot actively do a proving.
Okay. So after the proving, we come to the stage of using those remedies in the clinic, and you are one of the foremost clinicians in India and of course around the world. You have been associated with different hospitals also. In fact, you were one of the first few people who started homeopathic segments in big allopathic hospitals also. In your personal view, how different is practicing homeopathy in a private clinic and in a hospital setup?
Yeah. So I purposely selected municipal hospitals more as compared to a private hospital, because basically in private hospital you may not get that kind of right encouragement from reference point of view. But from municipal hospital like KM hospital where I am associated with, the area is extremely vast. We started with a sports medicine. My first OPD was only sports medicine, but believe me, in that sports medicine I will get at least 3 to 4 surgical calls. Means go to the surgical ward and treat some surgical complication. I will also get few calls from intensive care unit. I will also get few calls from dermatological department. So in municipal hospital, the population is very vast. The doctors are too encouraging. The Bombay Municipal Corporation also is too cooperative. And as a result, what I see is that we have a very free hand. Whatever we want to do, we do, because there is no question of money. Everything is free. Whereas in private, you don't get that kind of encouragement. So this is the first difference that I would like to say. The second difference is, in private, the people may not be always be too genuine in continuing your homeopathy with that kind of faith. But in municipal hospital, I have seen that these poor people many times consider you as a god, and they continue treatment for months together till the time you tell them that, oh, you have to take treatment for 2 years. They will stick on to you for 2 years. So that kind of dedication we see more in a municipal hospital than a private. As compared to my own personal private clinic, there is not big difference, because what I do in private I exactly do in municipal hospital. Even though I see about 30-35 new patients in municipal hospital, I take about 8 assistants with me to take the case taking, to do the justice. I repertorize every case in municipal hospital the way I do it in my private practice. In fact, people who don't get appointment in my private practice, I send them to municipal hospital. So what is important is that for me there is no difference between private and municipal hospital. But the free hand that I get in municipal hospital and the opportunities I get to treat advanced pathology is great. And that's why I keep on expanding. I started with 1 municipal hospital, now I've got 3 municipal hospitals in my hand.
So over the years, last 30-40 years that you've been practicing in Mumbai, how has the social acceptance for homeopathy changed over the years?
Oh, too much. When I started homeopathy, there was hardly any faith. In my area, I think so, where I was practicing in the D ward, there were hardly 1 or 2 homeopaths. Today, I think so, in my ward or in my area, I've got more than 15 homeopaths. So surely this has improved. In those days, there was no publicity for homeopathy, thanks to Batras, because they have publicized homeopathy so much that homeopathy became so popular on radio stations, televisions, as an advertisement, and now everybody knows homeopathy, and I think so the awareness is too much.
But how do you relate to the way the people like Batra and others are practicing homeopathy?
Now that again is very doubtful, because I know for sure that they don't accept a very classical approach, and the doctors who are attached over there are not very skillful. Repeatedly they send me reminders that please come and train our doctors, but I feel so foolish that you appoint somebody and then you ask somebody to train them. So you should rather first train them and then make them see the patient. But of course, there is always 2 sides of a coin, the good and the bad side. So the good side is that at least they are doing publicity for homeopathy. The bad side may be that they are not very skillful in the classical aspect. So blunders will be created, and then they do a lot of suppressive treatment with ointments and creams and all those things which are not permitted by the organon of medicine. So yeah, that's the negative aspect.
So as a clinician, I would also like to know your views about certain myths that are present in homeopathy, because I myself come across them very frequently. Patients ask us those questions. One of the questions that very frequently patients ask us, do your drugs have steroids?
Yeah.
So why do you think this myth has come up, and why this is so prevalent?
I think so. I have been the biggest victim in India regarding this. So many patients, so many of my very good patients have left me. So many patients have blamed me as a corrupted doctor. And I can't tell you that humiliations that I have undergone, even though repeatedly I have written in Times of India about this, but it has no effect on the major public. The reason is that our friends, our brothers, allopathic doctors, are the main culprits of spoiling our Sully name against steroid and homeopathy. I have printed on my envelopes that if you doubt my medicine, get it analyzed in a certain way, and that will give you the results. I am so bold that I was, I think, maybe the first physician in India who prints this on his envelope about steroids. But unfortunately, even after doing this, people blame me that I put steroids in my medicine. The reason is that they do a very simple test of what is known as reducing sugar test. And that shows positive in every medicine, because our homeopathic medicine contains lactose. As a result, since last 8-10 years, I have stopped giving powders to the patient. So I only give a liquid medicines. Many patients do the test and then they come and say, sorry, we doubted you, but still majority are so ignorant that they don't want to do the test, and yet on hearsay, they say, oh, homeopathic medicine contains steroids. So what I would like to do is that every individual doctor, homeopathic doctor, before they start homeopathic treatment, should either give some literature on steroids and homeopathy, or make them explain all those things, or print like me and literature behind their envelope. So at least 60%, 70% can be convinced. The rest, doubtful Thomas will always doubt you. Whatever you do, they are not going to accept that. And then you have to also tell your brother, MD doctors, that stop doing this. We don't need to give steroids because we have got the wonderful therapeutics to cure you. Why you should do that? I had a case of a surgeon whose grandchildren had diarrhea, and I treated the diarrhea with podophyllum, and the medicine worked like magic. And the surgeon told his daughter-in-law that Dr. Master would have given steroid to stop the diarrhea. She goes and gives my powder. In those days I was using powder, and it shows positive steroid. She quarreled with me, she got angry with me, she fought with me. I couldn't even explain to her. And I said, do this test because this test is more powerful. It doesn't have to do with reducing sugar. But she was totally brainwashed by her father-in-law.
But this happens very frequently in our clinic. I remember recently a case of nephrotic syndrome came with +3 protein in urine, and the case was sent by a radiologist through a reference, and they were not able to control, the allopathic doctors were not able to control the protein that was coming. And after the medicine that I prescribed, the protein stopped in like 2 weeks' time. And the first question I got a call from the radiologist that, did you give some steroids? Because we have not been able to stop the protein since so long, and you stopped it in 2 weeks' time. And I had myself difficulty in explaining them, look, that the medicines do not contain any steroids. Rather, homeopathy does not have any steroids to give. I would have to actually mix allopathic steroids to give that. But so that is in fact the challenge. How do we address it more powerfully? How do we make it?
I think so. Repeatedly, we should write article in newspaper. So far, I have written at least 5-6 articles, but I am the only person who writes such articles. We should call a press conference. We should make a public awareness. All these things are very important. I had a case of a very big industrialist who had a trigeminal neuralgia. His neuralgia gets cured. His neurophysician says, give the medicine for analysis. Thank God the analysis came negative, because he did exactly the same test which I asked him to do, and the neurologist then kept quiet. So here what happens, it's a little maybe an envious nature from the allopathic system, that they don't want homeopathic doctors to have successful results, and when they achieve that results, they feel, oh, it is only because of steroids. So that kind of awareness, that kind of discussion should be more and more kept on YouTubes or on other medias, on Facebook, Twitters. I think so, then all these things should be okay.
So, although very small proportion, but there are some homeopaths, probably poorly qualified, who do under the table you mix allopathic medicines like quinine or steroids with their homeopathic powders, and probably they are also a source of this bad name.
Honestly, I really don't know, but my gut feeling says that a BHMS qualified homeopathic physician may not do these things. This is what my gut feeling is. I am not very sure about it, because if he is a qualified doctor for working for 5 years in a medical school and he has not seen all those things, then why he should adopt that in his practice? I think so. These are done by the lay homeopaths, maybe, to popularize themselves, or maybe it was done some years back. I don't say. But nowadays, I don't think anybody does this, but we have to suffer from the wrong blame from the past legacy.
So, one of other myth that very frequently we hear is that homeopathy works slowly. Now, because in our practice we see that homeopathy works fast, very fast.
Yes.
rather faster than any other allopathic medicine if prescribed precisely.
Yes.
So why has this myth come up that homeopathy works slowly?
Now see, there are various reasons for that. Majority of the time, if you say, let's go 30 years back, 40 years back, homeopaths only saw chronic cases. Homeopaths never saw acute disease. Today, homeopathic doctors are seeing acute illnesses. Now, a chronic disease for 20 years, chronic disease for 10 years, chronic disease for 5 years will take 5 months, 6 months to get well. They consider that as slowness of action. So that's one reason why they say that homeopathic drugs act very slowly. Secondly, the effect of painkillers basically is much faster than homeopathic drugs many times. And that is why people correlate that painkiller action with general status of homeopathy and label homeopathy is very slow acting. So I think so these are the only ways why they feel homeopathy is slow acting. Otherwise, in all the other ways, we see that homeopathic drugs, many times you put a drop on the tongue and in 10 minutes you see that the sensation or a symptom has disappeared. Such kind of cases has been reported in literature repeatedly.
Yes, sir. Indeed.
And I think so, I totally agree.
So, one last myth that I would like to ask your views about is that patients often tell us that, even doctors say this, that with homeopathic medicines the disease is first going to come out. बीमारी पहले बाहर निकलता है फिर ठीक होता है. And I have seen horrible aggravations being produced by homeopaths in the name of this exteriorization of disease to the surface. What are your views regarding this?
You are right, totally correct. Now here again, as I told you, the skill of the homeopathic physician is of doubtful value. 80% or 60% of patients where there is a failure, the real cause is not failure of homeopathy, but the real cause is the poor skill of a homeopathic physician. Let's take example of skin disease. I think so what you are trying to aim at is basically what people when they suffer from some eczema or some psoriasis or some allergic eczema like atopic dermatitis. You give a medicine and there is an aggravation. First of all, many times homeopath doctor, even though he has been trained that skin should be treated as a whole and not as a local disease, all homeopathic doctors, majority of them treat skin as a local disease and their first prescription will be either sulfur, graphitis, arsenic, mercury, etc. etc. But they don't look at the whole patient and think of calcarea carb or pulsatilla which covers the eczema. So when you locally try to treat a skin disease and suppress the local symptoms, aggravation comes in a very big way. Number two, when you give a very high potency in a sensitive person, aggravation comes out in a very big way. So maybe looking at those aggravation, people feel that homeopathy pehle bahar nikalta hai or homeopathy brings out everything out first and then everything subsides. So such kinds of aggravation should be stopped. Such kind of aggravation should be discussed with the homeopathic physician and make him aware that please treat the person as a whole and don't just locally treat the skin disease. Don't fire high potencies to a sensitive patient. Use rather an LM potency for a sensitive patient. Stop repeating too frequently without knowing the follow-up of the patient or sensitivity or susceptibility of the person. All this should be taught to the physician. Otherwise, if you are removing that skin disease part, I don't think there is aggravation when you treat metabolic disease or when you are treating a pain part of it. No, I don't think so. I don't see much aggravation in my practice, whether charitable or in my private practice or hospital practice.
Neither do I. Sir.
Neither do I. No, I don't think so.
So it has been a wonderful sharing of your views regarding varied topics. You have been an academician, a clinician, and you have taught so many students nationally, internationally. What one message you would like to give to our audience, because this video is now going to be seen by nearly 65,000 people across the world. So what one message you would like to give to homeopaths to become better homeopaths to the future generation?
Okay. So the first thing I would like to advise to the students is that don't be a victim of anybody who claims that my method is Hahnemannian. believe only Hahnemann for Hahnemannian method. Huh? There is only one Hahnemann, there are no multiple Hahnemanns. Organon of Medicine 6th edition is still a very valid book to study and understand homeopathy. Philosophy is extremely important to understand homeopathy. Homeopathy is a three-legged stools, I would say. Repertory on your right hand, Materia Medica on your left hand, and Organon on your left. If you consider this is a triangle, don't leave that triangle. For Materia Medica, use only a reliable Materia Medica. Stop attending seminars, webinars and teachings of those neo-gurus who advocate their own method, who try to popularize themselves more than Hahnemann. This is extremely dangerous because that is the real cause of downfall of homeopathy today all over the world, including India. And third is do lot of hard work. Study at least 3 hours every day to revise what you have already known and pay attention to every single case that comes to you. Take it very seriously. Try to find solutions. If you cannot find, go to a senior homeopath. But please do not spoil the name of our system of homeopathy. Today we all should be very proud that we are born in India, we got education in India. One more thing I want to add, that today the most important thing that has impressed me a lot is the Central Council of Research in Homeopathy. It is one of the best institutes that has done so much research work. Recently I came from a conference where I saw so many research papers contributed by Central Council of Research in Homeopathy, and I am very, very proud that India is number 1 in the research field of homeopathy in the world today. Thank you.
Thank you, sir. Very sane advice coming from you. Thank you so much for your valuable time.
Thank you.
Thank you so much.